Gives me pleasure to welcome you to our session on exercise and lymphedema presented by Anne Dimenna. Many of you will know Anne from the sessions that you've been viewing through Lymph Ontario on Friday mornings when she did a whole series of workshops every other week. So I'm sure that she is a familiar face to many of you. And comes well qualified. She has a Bachelor of Science and she has training as a physiotherapist, as well as taking extensive training to become a CDT therapist. She's a member of the Lymphedema of Ontario Association, has her own clinic, and I think for the last 10 years has been very well versed in working with people with lymphedema. Next. So before we start this session, just want to acknowledge that many of you know now that this is our 15th year anniversary of being the resource to promote optimum healthy living with lymphedema. And we have a number of special events planned, specifically March the 6th, and then our 15-year AGM on March the 25th. Next. Many of you know the goals that we've worked on throughout the year, and we do try to keep all of those balls floating at one time with different committees, and so I won't go into them any further. Next. Okay, we've recorded a series of 6 webinars. Slight change in plan, and Drs. Weiss and Dr. Brown and Isaac have been unable to do a webinar at this time. They're pretty heavily involved in dealing with COVID, along with their normal patient load. So, but we do have the other 6 webinars as outlined there. Thank you. Okay. Without further ado, I'm going to hand it over to Anna to carry on and introduce her session. Thank you.
So I'm happy to present this topic to you, lymphedema and exercise, but everybody's situation is different, and the reason for your lymphedema is different, and how you're managing your lymphedema is different. So some people have had lymphedema because of cancer, surgery, treatments, or they're born with lymphedema. And so because of that, everybody's past medical history is slightly different. And so this really isn't meant to be individual medical advice. You should always consult your doctor or your physiotherapist, your lymphedema therapist, to address your individual needs and determine which exercises are safe for you to do. What I'm going to talk about today is about exercise and its benefits, the general exercise guidelines when it comes to lymphedema, different types of exercises, and then I'm going to highlight some of the research on exercise and lymphedema. Before we go into talking about the general benefits of exercise, it's important that everybody understand the function or the way that their lymphatic system is designed. So the lymphatic system is designed so that you have skin lymphatics that are in the layers of skin. So you have vessels, and then those skin lymphatics go down to deeper lymphatic vessels that would be around the muscle, and even deeper that go down to the areas around the bone. And then those lymphatic vessels traverse all the way up to the lymph nodes that are in your underarm and disperse throughout your body. So heavily lymph node basins in through your neck, your underarms, your abdominals, and then of course in through your hips or the inguinal area. And so exercise is going to help promote function of that lymphatic vessel system, and also contraction of the lymphatic vessel system to move fluid, obviously a lot faster back to your heart, where it has to join your regular circulation. So the general benefits of exercise. So there's been a lot of research on exercise and its general benefits. And I think these are, like, just looking at this slide would tell me that exercise is great for everybody. It improves your lymphatic function. You get improved overall lifestyle and quality of life and life satisfaction, improves strength and range of motion, improved mood, improved sleep, improved memory, weight loss. and improved overall function. And the list goes on and on and on for exercise. And so I cannot stress how important exercise is for everybody in general, but especially for lymphedema patients, because it does help move that fluid, that lymphatic fluid that can sit very stagnant in your lymphatic limb. It does help move that fluid back to your circulation so that you can flush out that junk that's kind of hanging around. So just to highlight the different types of exercise, there are cardiovascular exercises. So those are exercises that, like running, walking, jogging, things that would get your heart pumping and moving a lot harder and faster, so that it circulates that blood. There are stretching exercises to help stretch the muscles and elongate their length and relax the muscle tone. There are strengthening exercises such as weightlifting, resistance training exercises with bands, or even, isometric type exercises where people lift their own body weight. There are balance exercises to help work on people's balance. And then yoga, water exercises, swimming, Tai Chi, there's all different forms of exercise. And all these forms of exercise are extremely important for people with lymphedema. And I would say balance exercises are very important for people living with leg lymphedema, because there is some research to show that over time, if you've had leg lymphedema for a long period of time, that your balance does become compromised and your walking does start to change with time because of the weight of the limb. So when it comes to exercise, I talk about range of motion type exercises for people after surgery or for people who are recovering from surgery. And so this is a little bit about this side, but simple range of motion exercises to reduce pain and increase the range of motion of your joints is really important for lymphedema, because what we see over time for people who have a lot of swelling is that their joints do become restricted in their ability to move. And so full range of motion would be lifting your arms up over your head, lifting your arm up in front as high as you can. And we can see that those become very limited with lymphedema. And number two is that you need a full range of motion of the hips and the shoulders and all of the joints within your limbs. Because otherwise, if you don't have full range of motion, what we see over time is that people get shoulder pain and hip pain, and you get other joint pains from not having full range of motion. And safety is important when you're doing exercise. It's important to be very careful with the exercises you choose, and you don't want any setbacks. So you make sure that you start slowly, and we don't want you to injure yourself. So when we talk about muscle and joint pumps, this was something that Dr. Foldy coined many, many years ago. The muscle pump really occurs when you get a contraction of the muscle, which increases lymphatic fluid movement through the lymphatic vessels. So if you think of your lymphatic vessel like this long spaghetti-like structure, and it has all these little channels in it, when your muscles squeeze, it pumps the lymphatic vessel and it helps propel the fluid forward through the lymphatic system so that it can return back to your circulatory system at your heart and join the veins at the heart where it's supposed to return. So weak muscles would result in less of a muscle contraction. So you'd have less of a muscle pump, and that would affect the amount of fluid that is moved out of your lymphedema limb. So Foldy would say, and I would agree, that you need strengthening exercises if you have lymphedema. And those strengthening exercises can vary. It can be something very simple, like lifting a 1 pound weight or a 2 pound weight. Sometimes I even just encourage clients to lift like a water bottle, a 1 liter water bottle or a 500 ml water bottle, just to get that nice contraction of the muscles to move the lymphatic fluid. The joint pump, it can be performed with active or passive movements, which means when you have full joint range of motion, you're actually fully contracting those lymphatic vessels as well. And so what happens with people who are paralyzed or people who are bedridden, but they still have quite a lot of swelling, they can't actively move their joints. So it's important for somebody to learn how to passively move them. So what that means is somebody would be taught from a physiotherapist likely, or a lymphedema therapist, if you're seeing a massage therapist, is to move the arm through the range of motion comfortably for the person. And you'd have to be taught how to do that. But it is really essential that you have that joint pump if someone doesn't have strong enough muscles to move their limb, their lymphedema limb, through its full range of motion. And really, full range of motion within the joint results in an increase in fluid movement as well, and it's essential. So then I talk about decongestive exercises, and I know there's a lot of talk in the lymphedema community about what decongestive exercises are, and there's a lot of different decongestive exercise routines. I highlight one particular routine in our book in the exercise chapter. And decongestive exercises are exercises that you would typically do when you are working in the active phase of compression. So when you're being bandaged, or when you're in, a garment, it's not the same, but garments can help decongest the tissue if you're in a garment that's maybe a Velcro type garment. But decongestive exercises, in my mind, are typically done with people who are in their active phase of lymphedema management and trying to reduce their lymphedema limb. So there are different routines, very specific routines for arm lymphedema, starting at the shoulders and working your way down towards your hand and your fingers. And for leg lymphedema, it's starting at the hips and contracting the muscles at the hips and working your way down to contracting the muscles that would move the knee, and then contracting the muscles that would move the ankles and then the toes, and working your way up. So typically in decongestive exercises, we're activating the muscles at the shoulder, and I'll give you an example. I think you can see me in the screen, but you're going to do like a shoulder shrug to activate the muscles at the shoulder and try and get those to relax. You can do a circle or a shrug. And then typically we're bringing the arms up to the side, so we're getting shoulder range of motion there. And then the arms coming up in front. And usually I tell people to do somewhere between 5 and 10. If you're extremely deconditioned, you might do 5. If you're fairly in decent condition, you might do 10. Then you're going to do elbow bends, and hopefully you can see me. And then you go down towards wrist movements, which is just moving the wrist back and forth. Some people also like to do wrist circles, and that's perfectly fine as well. And then just opening and closing the hand. And then with this routine, people would go back to the wrists, and then back to the elbows. And then again, you'd go back up to the shoulder and then to the neck again. So what you're doing in one direction, you're also doing in the reverse direction, which means you're stimulating the muscles at the top, helping move lymphatic fluid in that area, working down and stimulating the muscles towards the hand and activating those lymphatic vessels, and then trying to chase the fluid out with muscle contractions that would bring you back up to the shoulder. Okay, and then in leg lymphedema, it's the same thing. Head and neck lymphedema, they have a similar routine, would start with neck movements and then facial muscle movements if people have face swelling. Again, very important to discuss it with your lymphedema therapist. And again, you can look at the book. These exercises are quite simple for people to do. So what does the research say? So I always find it interesting to go to the research. I think research should always guide our decision making when we're talking about health conditions, and typically it guides our decision making when it comes to exercise as well. So you'll see that there's a lot of research in lymphedema in terms of exercise, more related to breast cancer, because there is a lot of funding in that area, and it does affect a lot of women. So there is a lot of research on lymphedema and breast cancer. And so I'm going to be talking about that. But a lot of these principles we know can be applied to leg lymphedema patients. It's just that leg lymphedema patients need to be a little bit more careful about the types of exercise they choose. And I'll talk about that towards the end. So when it comes to exercise and lymphedema, so Bowman in 2018, he found 11 studies on breast cancer related lymphedema. And the studies included all types of exercise, aquatherapy, swimming, weight training, yoga, cardiovascular type exercises. And 4 studies showed that there was actually a decrease in people's swelling simply with doing exercise. And so that's amazing. And helped really shape a lot of what we do in our clinic with exercise and lymphedema. 6 studies showed that there was a decrease in body fat, there was an increase in overall muscle strength, there was an increase in range of motion, there was weight loss, and an increase in quality of life. And for all of those reasons, I think people should engage in exercise who have lymphedema. And he found that there was actually no adverse effects at all found in these 11 studies. And so it does prove that lymphedema patients can exercise quite safely as long as you choose the right exercises that are specific to your needs. So then there's been exercises on strength training and exercise for breast cancer related lymphedema. And there are a lot of studies out. This is part of the Smith group of researchers from the United States. Zhang was part of this group, or Zhang, sorry, is part of this group. And they've done exercise since around 2009. And their cohort population is typically 70 women per group. So this study was done in 2017, which is a little bit more recent. And their studies have really changed the way we think about treating women who have lymphedema with exercise. Because in the past, there used to be a lot of fear around giving women who have breast cancer and related lymphedema, giving them exercise out of fear that we would make their lymphedema worse. So in the past, women have often been told to do very little lifting, very little housework, try and rest their lymphedema limb. But what we actually see is that's actually not the right advice anymore. The right advice is to actually teach women to progressively strengthen their lymphedema limb. And these are the reasons why. So their study included 141 women, and it did go for 1 full year. So they had 13 weeks of twice weekly exercise. At the beginning, it was supervised exercise. It was 90 minutes. They had a physiotherapist that was with them for each of those sessions at the beginning. And then they were given a free membership after 3 months to their local YMCA so that they could continue to do the exercise routine that they had safely learned. And they were taught how to progressively increase their weights over time. And they also kept the diary, and they were also called, by the study supervisors basically to check and see how they were doing with their exercise program. So they did have constant monitoring, which sometimes helps. And what they found was, so I'm going to explain the study. So they increased by the lowest possible weight, and they did use compression garments to exercise. So I just want to state that whenever you're exercising, you should be using your compression garments. I know sometimes people say that they get very sweaty, but it's important to have one to wash and one to wear. So if it gets very sweaty during exercise, you take it off, throw it in the sink and give it a nice wash, and put on your clean compression garment. And they increase their lean body mass over time. They increase their bone mineral density over time. They decrease their body fat. There was no changes in their lymphedema, which meant that typically their lymphedema didn't get worse. It didn't get better, but they did not have a negative effect at all in this study. And so it does prove just that exercise is actually quite safe for people with breast cancer related lymphedema. Weight training as a prevention of lymphedema. So this again is the Smith group in 2010. They did this study, and this was some of their earlier research. Again, it was a 13-week study, a 13-week twice weekly supervised exercise followed by a YMCA membership that would carry them out for the full year. So they essentially had a year of exercise, and they were analyzed at different intervals, usually at about 3-month intervals throughout the study. And this is now the PAL study for exercise. And so the PAL program has now become the Strength After Breast Cancer exercise program that lymphedema therapists can become certified in delivering. So it's good if you are a patient living with lymphedema, maybe discuss whether or not your lymphedema therapist is trained in the Strength After Breast Cancer exercise program if you have breast cancer related lymphedema. Some lymphedema therapists don't realize the program is out there and that they can become certified in administering it. But I think it's really great for lymphedema therapists to have a great knowledge, extensive knowledge about how to help their breast cancer related lymphedema clients progress. And again, these principles can all be applied to leg lymphedema as well. It's just that the exercises you choose will be different types of exercises. So at 1 year, the exercise group had 11% had lymphedema at 1 year. And so the control group, there was 17% had developed lymphedema. So this group was, this study was done on women that did not have lymphedema, and it was really to see if lymphedema would develop because of exercise at a faster rate than the control group, which did no exercise at all. So what it shows is that the exercise group got 11% lymphedema, so that was 8 of 72 participants, and the control group had 13 of 75 participants that developed lymphedema. So the rate of lymphedema development, it was pretty much equal in the control group as well as the exercise group. And the control group just went about their normal activities of daily living. They were not asked to change anything in their life at all, so they truly were a control group. Of the women who had more than 5 nodes removed. So then they took the group and they said, well, we'll look at just the group that had more than 5 lymph nodes removed. The exercise group had a 7% rate of lymphedema. So actually a very low percent. So only 3 of 45 participants had developed lymphedema. The control group actually had a 22% rate of lymphedema. So 11 of 49 participants had developed lymphedema. So what that tells me is when you look at these numbers for women who had more than 5 nodes removed, exercise is actually providing some degree of protection against them developing lymphedema over time. And so I think that's important to see because sometimes people who have had more lymph nodes removed are told to be even more careful about not lifting weights, about not carrying the groceries, about not carrying their heavy laundry baskets. But in reality, we know that that's really not true. And these research studies on people who did not have lymphedema are really proving that they don't develop it at a faster rate because of exercise. So it really proves that exercise is safe and it may play a role in the prevention of lymphedema. So the bottom line when it comes to exercise is good for lymphedema. It keeps our heart in good shape. It helps circulate lymphatic fluid. It helps make us happy. And it's hard to really determine the best types of exercises because there are so many benefits to exercise. I hate to tell people to do a particular type of exercise because it's really important that you do the exercises that you're happy doing. So if you're a walker, that's great, walk. If you're a person who, likes to ballroom dance, like that's an amazing exercise. Typically, people who have lymphedema can be returned back to the exercises that they've done in the past and the exercises that they've enjoyed. Sometimes you might need little modifications, but you can do that. So, for example, golfers, if you don't have full range of motion, so your stroke might be a little shorter and you might not move the ball as far down the golf course, but you can still golf even if you don't have full range of motion and you still have lymphedema. So there are many types of exercises that can be performed. Again, dancing, dragon boat racing, water polo, really, really important to pick something that you can stick with. And I would encourage people to find a buddy. It's great if you have a person that you can exercise with, or a person that can help motivate you. I know COVID has sort of changed our interactions, but it is really great if you can find somebody that you can even talk to over the phone. You talk about your exercise goals and your exercise plans. Maybe encourage each other to do just a little bit more. If you're only walking 5 or 10 minutes, maybe they can encourage you to walk, 15 or 20 minutes. And you always think of exercise as being something that's additive. So what that means is if you're a person who can only walk a short distance, that's okay. It's okay to walk 5 or 10 minutes. But if your goal is to get to half an hour of walking in a day, then maybe you walk 3 different times in a day. So you're doing 10 minutes in the morning, 10 minutes after lunch, and 10 minutes after dinner. You're getting in that additive component to the exercise. And if you're someone who wants to start with a weightlifting program, start very slowly. You might just do one muscle group. So you might just do your bicep curl. And you might just do that over the course of 2 weeks to make sure that it does not flare up your lymphedema. For people with leg lymphedema, I think it's important to say what we see in our clinical practice. What we see in our clinical practice is cycling tends to be using an exercise bike, or an outdoor bike if you're safe to be on an outdoor bike. It can be very good exercise because you don't have that pounding force through your joints and the heaviness of your limbs. Water exercises can be amazing. And I know you guys have better weather out in BC than we have in Ontario. And so hopefully you can, get into the water more often. But water exercises do add that degree of compression when you are in the water. So the deeper you are in the water, the more pressure you have. So I think it's about a 0.6 millimeters of mercury per centimeter deep. So, if your feet are 100 centimeters down in the water, you're getting, 50 millimeters of mercury pressure, essentially. If they're more than that, then you can get up to 90 millimeters of mercury pressure, which is actually higher than your compression garment. And typically what we see with water exercises is after you are in the water for, your period of exercise of half an hour to an hour, what we see initially is that there is a reduction in lymphedema girth, but that girth or the measurements actually are the same by the next day. So that fluid does return. But I still say that I think that's okay, because what it tells me is that the water exercises are actually acting like my manual lymphatic drainage would, or like exercise would, because it actually reduces your limb temporarily. That means that it's moving out that stagnant lymphatic fluid and making sure that it all flushes out. And it is so important to think of that as an important goal, is to move out that stagnant lymphatic fluid. Really, because if you think of that lymphatic system, it's removing toxins and debris from cell breakdown, getting rid of bacteria that your immune system might have killed in the area. And so it really is getting rid of the junk, like the sewer system of your body. It's flushing out all that junk. So really important to circulate out that lymphatic fluid and that junk. And even though it's replenished and it comes back, at least it's coming back with something that hasn't been sitting for weeks and weeks at a time. And so this, in my mind, is important because it should help prevent you from having cycles of cellulitis or infections. If you are a person who does develop a lot of infections, that stagnant fluid is what the bacteria like to live off of. So I'm going to talk about where to start. So you're going to start with a warm up, something simple like marching on the spot. Good to get your heart moving and your heart beating and the blood circulating and getting that blood to your limbs. Then you do like a general stretching routine, and then you do your main body of exercise. So if that's, golf or dancing, important to do that stretching beforehand. And then you'll do your cool down, and you'll probably add a little bit of stretching in that cool down as well, depending on how much exercise you've done and how tired your limbs feel. This is the book The book is called The Complete Lymphedema Management and Nutrition Guide. And I just posted the coupon code again. It's still LAO 2020 that we had all of last year through COVID. That's from our website, which is www.markhamlymphaticcenter.com. The coupon code gives you the book for $20. You can buy it on Amazon, any major bookstore. Chapters, Indigo has it as well. I think it's $27.95 when you buy it there. And that's me. So you can reach out to me if you have questions after the presentation that maybe aren't addressed. I'm happy to try and help direct you. I am only a practicing physiotherapist, unfortunately, in Ontario, and I can't provide virtual care to people who are out in BC, but I can help direct you to people who could maybe help you. And if you just have simple, questions about exercise, questions about lymphedema treatment, I'm happy to do that as well. And so this would be, the BC information that Christine is going to finalize.
Right, thank you. Yes, so this is just information about how to reach us and contact BCLA, which we presume you've already found it if you've managed to find this particular webinar. So Anna, I want to thank you for that presentation. I'm just looking to see if there are any questions. There was one that I saw, and you mentioned about the reduction in volume with Aquasize. So if a person put on compression right after they come out of the pool, could they maintain that reduction with their compression through the next, if they're doing day and night compression? Can that work?
I think it depends whether or not your garment was fit for your limb at a smaller size. So it always comes down to when your garment was measured. So let's say you were a person who measured at your ankle, let's say 25. You went into and that was what you measured your ankle to be for your compression garment. You go into the pool, you come out, and your ankle is now 22 or 23. So it's 2 centimeters less. Your compression garment is still fit to be 25. So typically what happens is people go and they do their pool exercises and they can pull that garment on quite easily after that dampness in their skin disappears. And so sometimes what happens is your limb, as you go about your activities, is just going to progressively grow that swelling back. The best thing to do, if you are someone who's learned to bandage and you already know how to do that, is to go in the pool, do your exercise. When you come out, I would encourage you to bandage. And if you do that, and you do that routine maybe every day or every other day, you may see a significant reduction, because a bandage would be an inelastic garment. So it would be something inelastic, which means you can't grow in a bandage unless it isn't being put on properly. It will help maintain a volume reduction. So you could use aquatherapy with bandaging as, part of your intensive or active phase of lymphedema reduction.
Okay, so actually that could apply then, that if somebody has found that their limb has swollen and that getting on their current compression garments has become difficult, which I hear quite often, doing some exercise in the water could help to get them back down to a size where that garment might be comfortable again.
Definitely.
And
you may, for someone, especially leg lymphedema, you may start doing some exercises in lying down as well. So stimulating contraction of that lymphatic system in lying down can also help reduce your lymphedema limb. And you may find that if your garments are hard to get on and you can't get to a pool, because I know it's awfully hard during COVID, just doing them on lying down can also be helpful on helping reduce the limb. But I do encourage people who haven't seen a lymphedema therapist to even have one session. I know, it's sometimes cost prohibitive, But it's important to learn how to do self-manual lymphatic drainage, because that should be part of your routine. In actuality, I tell some of my patients to do self-manual lymphatic drainage right before they exercise to open up their lymphatic pathways so that you can move even more fluid while you exercise, and then to do their lymphatic drainage again after exercise. And your lymphedema therapist can't be there with you when you're doing your exercise. So it's important for them to teach you self-management strategies. One of the reasons why I wrote the book is because you need those self-management strategies every single day, especially if you're experiencing a flare-up. If you're not experiencing a flare-up, you don't need to self-manage every day to a high degree. But when you are experiencing a flare-up, like your garments don't fit well, you do need, to treat it very aggressively from the beginning.
Okay. Now, would we have any other questions? If other people if you have a question, if you want to turn your mic off.
There are a couple in the chat.
Right, okay. So now I see this one. Is it all right to do planks if you have arm lymphedema or you've had a mastectomy and want to prevent lymphedema?
So typically body weight exercises are not a lymphedema therapist's favorite for patients. However, I will always say however, because there's always somebody who comes into my office and says, I do planks every day and I'm fine. And they are. And that's because they were a very big exercise person before. Planks are not something new to them. And I find that people who are very physically active and able to do things before are typically the ones that can resume them without complication. If you're new to exercise and you're thinking you're going to, do a plank, then I would discourage it. And the reason I say that is because your body weight is so much more than you would lift when you're in a gym, right? Because most of us weigh 120, 150 pounds, and that's a lot of weight for our arms to support. And so a plank also is static. So it's not actually moving your muscles through their range. Static exercises also send a lot of blood flow to the area to hold you up and keep those muscles nourished so that they can do that. So when you get that influx of blood to the area for a prolonged period of time, you will typically end up with more swelling. So I usually ask people not to do planks, downward dog for yoga, any poses where you have a prolonged static position is, typically something that will flare you up. However, there are always people who try, and I usually say, if you're going to try, regardless of what I've said, I'd rather you had the knowledge to try for a very short period of time and monitor your limb, like you might do a 5-second plank or a 10-second plank. You're not doing a minute. And you're monitoring your limb to see the next day, is it worse? Or is it heavier? Is it achy? Is there pins and needles? Is your compression garment harder to put on? If it is any of those things, even one of those things, then I say plank is not for you.
Okay. So, because we didn't provide the opportunity for a lot of questions, but it's interesting that we have actually recorded one yoga session, and it is for somebody who is very experienced in dealing with lymphedema patients. So it's a very gentle beginning yoga session that definitely does not include any planks or downward dogs. So that's something that we're hoping that people will try after this. And I do want to say, Anna, I really thank you for providing the framework for people to be able to understand how they pick and choose about the exercise programs they join or sessions that they might selectively participate in, because you've given more of a framework about what to be thinking about and monitoring their own body. And particularly valuable that you dispelled that myth what was out there for so many years about breast cancer patients shouldn't be doing exercise. So really thank you for that. Many of our members I know do have your book, and hopefully now that they know how to find other copies, that more people will use that as a regular their handbook, if you like, to guide them through that, and with the information that Jean provides about nutrition. So thank you very much for doing this session for BCLA.
Thank you so much. I hope you enjoy it, and I hope it provides everybody with a lot of information and detail. And I hope it encourages people to, recognize that uh, even though you have lymphedema, there is so much that is within your control. And exercise is definitely one of them. It will bring you a lot more joy. It will give you a lot more strength, and you will see that you regain so much more function in your daily life. So I really encourage people to take on, exercise and try to do everything that you can do so that you can really live well with the lymphedema.
Thank you, Anna.
Okay. Thank
Really
you.
well said.
Bye.
Okay, bye-bye.